people don't have to dive into every single step right away. I think it's building it over time. And if you're going to introduce one thing, it should be the sunscreen, and then the other components you can add into as you get more confident and comfortable with your skincare routine.
This is Dr. Meenal, and welcome to Uncover Your Eyes, where we uncover reality. As a mom and eye doctor, I want to know it all. Your skin. Your skin is the largest organ of your body. It covers everything head to toe. Your skin is what protects you. And many of us, including myself, neglect our skin and caring for our skin, whether it's applying facial creams or protecting your skin from skin cancers. Today, I have a very special guest, Dr. Malika Ladha. Dr. Malika Ladha is a dermatologist who practices medical and aesthetic dermatology and has an interest in skin of color. She has published many journal articles and is an active leader for the Canadian Dermatology Association and the American Society for Laser Medicine and Surgery. Welcome, Dr. Ladha. So, thank you, Dr. Ladha, for being on today. Really appreciate it.
Thanks for having me. I'm super excited. And I feel like it's always
Yeah.
exciting to chat with different healthcare providers. And I feel like we'll both learn from each other today.
Absolutely. Thank you. So why dermatology? Why the skin? Tell me.
Yeah, I love it. I love that question. Dermatology is just such a fascinating field. For me, it was a bit of a serendipitous route into dermatology. And ultimately, I love that there's so many different aspects of dermatology. It's very visual, obviously. And I feel like to be able to approach a specialty looking at it from a medical lens, looking at it from a surgical lens, looking at it from a cosmetic lens, and to have that all in one place is so, so, so wonderful. I love that I get to work with patients of all ages, which is great. And I love the education piece. Like, I feel like this is a specialty which is unique because it overlaps with so many other aspects of our life and of society. It overlaps with beauty, it overlaps with
True.
culture. And to have that all in one place and to come at it from a scientific perspective is really, really unique. And, I think if there's any medical students or residents listening to this, or really anyone, I think a really big piece of why I picked dermatology was the people. It was people that I got along well with, people who were easily became mentors, people who I became friends with, and to have that and really find like a clinical home has been really nice. And so I know that was a lot packed into one,
No.
but it's a great specialty. It really is.
I love that you said that there's so many aspects of it, right? Because you talked about like beauty, like people care about their beauty. And one thing that I noticed, in your bio was that you kind of concentrate on skin of color. Like
Yeah.
that's so huge because, growing up South Asian and not, and always being told, that colored skin was always harder to deal with and things like that. So that really touched me that you wrote that in your bio that, you know, can you elaborate on that a little bit?
Yeah, absolutely. I think if we look at it from a health perspective, um, different conditions present differently in different types of skin. And so I'll give you an example.
Right.
When we have something like eczema in lighter skin, it shows up as red, and we see that red as inflammation. But in darker skin types, it doesn't necessarily show up with that classic red that we're taught with. And so having that expertise is so important to be able to diagnose the same condition in different types of skin, but also to recognize that darker skin types are affected more by different conditions. So melasma is a great example. We tend to see that in darker skin types more often than we do in lighter skin types. Um, and I think, as an industry as a whole, like I remember when we were growing up and you'd go to the drugstore, like nothing matched our skin type. And now
Right.
I walk into Sephora or Ulta, and I'm so always excited to see these different
Yeah.
brands coming out with things that work
Right.
for all different skin types, which is so exciting. And I think there's been that movement in dermatology as well.
Right.
We're seeing that in clinical teaching. We're seeing that even up to clinical trials where there's such a push and focusing on the importance of including all different skin types as different drugs are being researched. And I think, of course, there's cultural aspects to when we're in clinic treating patients. And, for example, something that's come up a little bit more recently has been this concept of hair oiling. And, little pro tip, if you have dandruff, hair oiling isn't the best thing for that.
Ah,
It can
okay.
really exacerbate dandruff. But, it's such a cultural practice for different groups.
Right.
And so it's having that nuanced discussion with patients, respecting their culture, and also recognizing that there's some extra education to be done for different groups. And I practice a mix of medical and cosmetic dermatology. And so a little bit of background, Canada has one aesthetic dermatology fellowship spot here at the University of Toronto, and I was really grateful to be able to do it and focus a full year of aesthetic learning. And even through that, one of my focuses has been of skin of color, because even aesthetically, we all look different. We all have different traits that are specific to different ethnicities, and to be able to develop treatment plans from a cosmetic lens for patients that includes that, takes that into consideration, is very, very important.
I love that. So, just about the different, how things are not available or now available of different skin for different skin types. So I
Yeah.
remember back in the day, when we were younger, we would wear foundation and
Yeah.
it would never match my skin color. So you could always
Yeah.
see that I was wearing it. So I kind of gave up and I just, embraced my blemishes.
Yeah.
But now it was funny because the other day I haven't changed my foundation in many years, but I went to Sephora and they
Yeah.
used this like iPad to scan my face and they got the skin color in a second. I was like,
A good
"Oh,"
match, right?
right? It
That's
was like and
amazing.
it had like 100 matches, and it was like, "We didn't have this growing up. Like, how lucky are these teenagers?" So
And then
it's
to have
amazing.
products that match that, right? Like
Right.
identification products. And listen, I still think the beauty world, aesthetics, um, every specialty in medicine has a long ways to go on this forefront,
Right.
but I am really glad to see that there is movement.
Yeah, I love that you have an interest in that. So tell me, like, I obviously do all my skincare wrong, so I'm not gonna tell you what I do because everything is gonna be wrong and you're gonna be bad. But what are the big no-nos, I guess, for skincare? Like, what to not do that I probably am doing?
No, you're all good. So, you know what? Can I flip that first and can we
Yeah,
talk about what we should be doing? And
absolutely.
then we can go into the
Yeah,
no-nos.
for
And I
sure.
think for some people, skincare comes so easily. It's something that they care about and they do all this research. But I feel like most people, myself included, um, we're busy. We have busy schedules. And I think first and foremost, less is more. That's like the number one rule, I would say. Less is more. So what do we actually need in our skincare routine? I think every skincare routine needs five basic things.
Okay.
Um, and really, we're looking for a good, gentle cleanser. So that's one part of it, a good moisturizer. And then the three things that are the most well studied in skincare and in dermatology are using an antioxidant like vitamin C,
Okay.
using daily SPF, and using a retinol or retinoid.
Okay.
And those three things are the best studied things that we have in dermatology in terms of skincare. And so incorporating those into a skincare routine. And I obviously have to put the caveat out there that these are general rules. Of course, it needs to be personalized and customized for every skin type. So not everyone can tolerate a retinol or retinoid, for example. But these are the five basic things of a skincare routine.
And to interject, sorry. And when
Absolutely.
should these skincare routines be starting? Like when you're a teenager, like we see the Sephora trend, or
Yeah.
when you're 40, like when should people be starting to think about having these five aspects?
That's a really good question. And so I think the three items that we can start even as early as tweens would be the moisturizer, cleanser, and SPF. Those are three things
Okay.
that everyone needs to use. And I know there's been this big craze around tween skincare. And, at every point in every generation, everyone's been curious about skincare. It's probably more amplified now with social media and access to different information. But I remember growing up and being obsessed with my mom's Nivea cream and my
Yeah,
grandma's like what was it, the Johnson and Johnson baby
that's right.
cream, right?
That's
Like
right.
those were
Yeah.
like things of their generation. And So I think that curiosity is actually a good thing, and we can maybe funnel it into developing good sun protection habits. That's a good place. Um, but really, the other components, the antioxidant and the retinoid, is something that we can introduce in our 20s. And again, it will be specific to the individual, but starting to think about those aspects of skin health, it's a good time
Absolutely. So what are the things that we should not be doing, I guess, then? Or like once
then.
I'm doing them, I need to know.
You need to know. I feel like there's a couple of things. So
Okay.
things that patients commonly come in with is over-exfoliation of skin.
Okay.
And it's just very, very common. I think there's so many different things available out there. And this is what I meant by less is more. Often patients coming having like 30 different products, half used, tried this, tried that. And in part of that process, over exfoliation happens. And I
Okay.
think it's really important to remember, and this is really, I think skincare is very integral to skin health. Like sometimes people see skincare as only a cosmetic thing, but truly it's integral to skin health. And as we mature, our skin barrier starts to weaken. And with that weakening, we really need to think about adding in skincare ingredients that boost that skin barrier to maintain protection for our skin. And so often when I see it, and this happens in all age ranges, but I'm seeing it more and more in younger patients because we're overusing products that aren't meant to be used on our skin at that age, is the overexfoliation. And so that can present with stinging, dryness, redness, like those
Right.
flaky patches on the skin. So that's kind of one big thing that we need to be avoiding. And then the other thing that and it's kind of the reverse of what I was saying, but is that lack of sun protection. And I think
Mhm.
any skincare that you use, any routine, no matter how great the science is, no matter how wonderful the formulation is, no matter what other treatments that we're doing as part of a holistic cosmetic treatment plan, don't make sense if we're not using daily SPF. And
Okay.
I think the other thing I want to add to that is that a good skincare routine extends beyond just the products we put on our face. And what I
Okay.
mean by that is thinking about UV protection from an even broader lens. So that would include things like avoiding the sun at its peak hours, 10 a.m. to
Okay.
2 p.m., using hats. A lot of patients use ball caps, but I think using something wide brim,
Wide
because if
brim.
you imagine, if you have a ball cap, you're still getting sun exposure from these different angles. So using a wide brimmed hat to help with that. Um, and it's not to say we shouldn't live our lives. We absolutely should. I want people outdoors. I want people getting time in nature. I want people playing sports. I want people to be swimming in the oceans. But it's just a matter of how we make sure that we're optimizing it to also protect our skin.
Absolutely. Very similar to what we say, right? With our sunglasses to protect our eyes.
Yeah.
But I am going to say one good thing about our generation was, I don't know about you, but my parents always pushed us to wear sunscreen, but their reasoning was different. It was to not get darker, right?
Yeah. Yeah.
But in a way, we kind of built that habit of just always protecting our skin unknowingly, but we were protecting our skin. And I think sunscreen is something that's so undervalued, just like sunglasses for the eyes. But it's like you said, it's the simplest and easiest thing to do, and it goes a long way.
Absolutely. And I think it's something we can do at every age, every stage of our lives. And that's not to say, like, listen, and back in the day, people used to sit out with tanning lotion and like hold like tinfoil to get extra sun exposure, right? And
Right.
we can't go back and change that. I say this to all my patients, like, we can't undo what's been done, but going forward, we're all living longer. We
Right.
have more information now. Like, that is such an easy step. And I always tell patients, just leave it by your toothpaste. So you're going to brush your teeth and you're going to put your sunscreen on in the morning. And listen, it takes a bit of time to find the one that you like and the one that you use, that you're going to use. What are we looking for? We're looking for SPF minimum 30,
30.
a
Okay.
broad spectrum to cover UVA and UVB. And then if we're outdoors sweating, we would like to use a water resistant sunscreen. And I love a good tinted mineral sunscreen, especially in skin of color. We know that it provides extra protection against conditions like melasma.
Okay.
But
And the
yeah,
mineral reason, what is the reason for having it being mineral?
it's the protection
Okay.
for that. Yeah, for against the hyperpigmentation and the melasma. It
Okay.
provides protection against visible light. So it's
Wow.
additional protection.
Wow, I didn't know that. That's and so, like for our kids and stuff, or even ourselves, like when should you be reapplying the sunscreen, right? Like I just do it once in the morning. I don't really
Yeah.
care to do it again. But is there a set time, like when I come home and then I want to take my kids to the park at 4 o'clock after, later on in the day, should I be reapplying? Does it really matter?
Yeah, good question. Totally should be reapplying. So I think the advice out there is every 2 hours. That's not
Oh my God.
realistic. Most people won't be able to. And if you're indoors, working in the clinic, the sun exposure is not the same. It's
Right.
limited compared to being outside in the park with your kids. And so applying in the morning, and then if you know you're going back out to sun exposure, reapplying then. And I think we have better and better options for patients who wear makeup to reapply over makeup as well.
Okay. That's good to know. I didn't know actually you can reapply on top of your makeup. So that's
You
really good
can,
to know.
yeah. There's some
Yeah.
really good options. And then the other thing to remember is to bring it down to your neck and then apply to the backs of the hands for
Ah.
that extra protection.
Amazing. So, what are like kind of the unpopular truths about like skincare or I don't know what, yeah, just like the myths or unpopular truths, like what would you say?
Oh my gosh, there's so many out
Okay, at
there. I
first
feel
you.
like we hear them constantly. So one myth that comes up all of the time is that retinoids thin the skin.
Okay.
And retinoids are a derivative of vitamin A, and they help in different conditions. We use them for acne at all stages of life, teenagers, perimenopausal, postmenopausal acne. We use it from a cosmetic perspective to help reduce fine lines and other signs of photoaging. And we help it to sometimes help a bit with hyperpigmentation. Anyways, there's a lot that we use retinoids for. And I
Okay.
always hear that retinoids thin out the skin, but they actually work by increasing collagen production in our skin, and
Oh,
they help to amplify and support the skin structure. And so it's actually the opposite. Retinoids don't thin out the skin; they thicken the skin a little bit. And I
that's
think
really
that,
cool.
yeah, yeah. So that's a big component. Um, Another myth that I always hear is that oily skin doesn't need moisturization, or acne prone skin doesn't need moisturization.
That's right.
And it's the opposite. We actually need to make sure that we are moisturizing oily prone skin or acne prone skin. And it's again, it comes down to that skin barrier, making sure that it's really bolstered, really strong, to help prevent any irritation from other things.
That's a really good point. Wow. I didn't know
Yeah,
that. Good
yeah.
for the teens, right?
Sorry.
Good for the teens because we were told, like, when we were little and we had acne, it was like, yeah, let it dry out, right? I mean, that's what the thought
Yes.
process was.
Yeah, and even when you have a cut, for example,
Right.
I think growing up, it would always be just leave it open, let it open to air and
Yes.
dry out. But anytime we do any sort of procedure in the clinic, let's say it's a biopsy and there's
Okay.
sutures left, or if you get a scrape on your knee from falling, it's actually good to use um, moisturization on that and keep it a little bit moist to help with wound healing. And I Here's another myth I hear all the time: to use something like polysporin on cuts. Dermatologists don't love that. Okay, we
Okay,
found
so
one
good
for
to
you.
know.
And why we don't like that is because there is an ingredient in that that can cause an allergic reaction in some patients. Even if you've used it before, it can cause an allergic reaction. So now imagine you have a little wound you're trying to heal and you cause an inflammatory reaction. It can make it difficult for the wound to heal, and then you often get itch and other symptoms of irritation. And so we limit that by not using something like polysporin.
Okay, so creams are probably better on those areas.
Yeah, or
Yeah.
like even something like petrolatum jelly,
Okay.
something. Yeah,
Perfect. You mentioned retinoids, I think. And I've always heard the term retinoid, retinol. I don't really know the
yeah,
difference.
yeah.
Are they the same thing or are they different things?
Good question. So it's all part of the same family,
Okay.
um, and retinoid or retinoic acid is in its biologically active form. So retinoids are available as prescriptions. That's something that you would go to your dermatologist to get a prescription for.
Okay.
And as soon as it's applied on the skin, it's available to the skin, and so it's stronger than a retinol. That means it also might be a little bit more irritating for the skin. Now, a retinol is the precursor to a retinoid. And
Okay.
so it's further away from being biologically active. So your skin actually has to convert it over. And with those conversions, it means that it's less potent, but also maybe less irritating for the skin. And retinols are available over the counter as cosmeceuticals.
So when we're looking for, you were mentioning, starting in our 20s, like that's something that we might want to consider. Are we looking for, because we're going over the counter, it will end up being a retinol, correct?
Correct, correct. Yeah.
And that's
Yeah,
good enough
absolutely.
then, you would say? Yeah.
Yeah, and if we're using it to treat specific conditions, using the prescription strength will be important there. And the most important thing, whether it's a retinol or retinoid, is consistent use. And
Okay.
so, if you're able to tolerate a daily retinol, that's more important than using something stronger once or once a week or every other week. That consistency is really, really important.
Okay.
And I
So
think
what
that's
are
true
the
for all of skincare.
Right, right. I
Yeah.
agree. Like having even sunscreen, I guess, right? Doing it daily is important, you know.
Absolutely, and it takes time to see the benefits of this. It takes time, and I think that would probably be the biggest myth I would love to bust is that
Yeah.
there's no overnight product that's going to give us amazing skin overnight. It's too good to be true if someone's saying that. It all comes down to right ingredients, right formulation, but most importantly, consistency.
Right. You mentioned the amount of potency and things like that. And then we were talking about sunscreen and you said it has to be above SPF 30 or 30 and above.
30
So
and
does
above.
it really, I've heard that 45 versus 60 doesn't matter, it's all the same. So should we just be getting 30 or do we need to go up? Like how do we know what number to get above 30?
Yeah, that's a good question. And so it does change the amount of UV coming through to go to a high number. Um, if you use SPF 15, and a lot of moisturizers have SPF 15, that's not enough for us.
Okay.
And so, yes, using an SPF 50 is great. If you're not going to use the SPF 30, the other I think important thing with that is the amount that we use. And so SPF 30 is only SPF 30 if you apply the correct amount. And so the general rule of thumb is for your face is using two whole finger lengths worth of SPF um, to achieve that protection.
Wow, that's okay. I don't know if I use that much, but that's
And
I always
that's
find
why, like,
sunscreen so sticky and icky, so I don't love putting it on, right?
okay, we need to get you a sunscreen you like. That's the other thing is finding things you like actually like and want to use, and
Right.
it's trial and error. And
Yeah.
this is where I think being able to go into your dermatologist's office or into the drugstore to test out these different sunscreens is so important because
Yeah.
what works for you may not work for me. And a lot of it just comes down to this is where skincare again is so personalized. People have different affinities for different textures and smells and even
Right.
how to be able to use all these different things. And so it's really finding what works for you.
Yeah. What um what are common skin conditions that you see day to day, women, men, or like altogether, just common skin conditions?
Absolutely. And so part of my practice is medical and the other part is cosmetic. And so on the medical side, common things being common, a lot of acne, rosacea, eczema or atopic dermatitis, psoriasis, skin cancers, as a bulk is the bulk of what I do
Mhm.
on the medical side. And then on the cosmetic side, I see a lot of patients who really want to develop a holistic, positive aging treatment plan, which includes everything from like optimizing skincare to chemical peels, using neuromodulators like Botox or Dysport, different types of fillers
Right.
to look and feel their best. And another common thing, kind of that overlaps with both of that I see is melasma as well.
Right. What type of what are the top skin cancers that you see, the names of the top skin cancers or most
So
common?
most common, yeah. When we think of skin cancers, we think of them in two categories. One is melanoma, and the other category is the non-melanoma skin cancers, and that includes basal cell carcinomas and squamous cell carcinomas. And the most common type that we see is basal cell carcinoma, That's the most frequently occurring skin
Okay.
cancer. And that's a type of skin cancer that grows locally in the area, but typically doesn't spread beyond that area. And
Okay.
then melanoma, um, there's different, obviously, subtypes of melanoma, but the worry that we have with melanoma and why we like to diagnose early and treat early is because it can spread to other parts of the body.
Right. And tell me, obviously, UV plays a big part in this, correct?
Absolutely. It's like the biggest thing that we have control over that does lead to skin cancer. We know that it leads to skin cancer. There's excellent data to support that. And this is why I feel like we sound like broken records, but this is why dermatologists continuously talk about sun protection. And I think it's important to remember that there's obviously a cosmetic component to this, right?
Mhm, mhm.
UV exposure accelerates signs of aging, fine lines, wrinkles, sunspots, hyperpigmentation. But for people who don't care about that, I think it's really important to understand that UV exposure also affects our health and skin health. And it absolutely does lead to skin cancer. And this is something that we can control how much sun exposure we get. And, you asked me earlier about different myths. So I'm going to bring up one more on this topic. It's that um, a base tan is protective for you. And I want people, if there's one thing people walk
I don't
away
know if
from
I've
this
heard that.
podcast,
Yeah.
right? Right? Like people get their base tan before they go on vacation,
Oh,
right?
interesting.
And I want everyone to understand that a tan is like literal evidence that you have damaged your skin. It's your skin's way of trying to protect against UV, and it's an actual sign that you've caused UV DNA damage to your skin. So
Wow.
so a tan is a sign of damage. And number two, a base tan has an SPF of 3 to 4, which is not protective. And so it does the opposite of what we want. It's only caused more damage and doesn't provide extra protection.
Wow. And we always see that, right? In spas or like even in gyms now, they have tanning beds at some of the gyms and people are coming out with tans before going on their trips. And I didn't
Yeah, and I
realize that that was their thought process, that a base tan protects you. I didn't realize that that was, I just thought they were doing it to look, tanned.
yeah, I think a lot of people still do it for that as well. Um, and it's unfortunate because we do see that that also leads to skin cancers unnecessarily. um, and I do hope that we've had movements where I think um, we've moved the tanning minimum age. I think it's 18, but
Oh, is it?
it's
Okay.
still, I believe so. I think there's been legislation for that, but even with that, it's unnecessary exposure.
Absolutely. Would you say, like, I know in the eye world, we always talk about, sunglasses, obviously, for
Of
protecting for the
course.
same reasons, for aging of your eyes. But would you say that a lot of sun damage happens like in our younger years and we don't even know it? Like, I know that we talk about that a lot, that, before the age of 18, a lot of your sun damage has already occurred. So it's good to protect when you're younger and your younger children. Would you say the same thing?
Absolutely. It's all cumulative.
Yeah.
And so that's why I think it doesn't, we can't undo what we've done in the past, but it's important to start now because we still have the ability to at least decrease the potential for that.
Yeah.
That being said, I think this is why we need to educate younger patients, parents about the importance of sun protection, because part of that is that damage does happen early on, and B, it's an opportunity to really build those sun health, sun protective habits in.
Habits, yeah, that's huge. The building the habits. So, you mentioned rosacea and psoriasis and other ones, eczema as well. You mentioned, but with rosacea, I see that a lot in the eye world, right? Because we have
Of
ocular
course.
rosacea. Um, a lot of people don't know they have rosacea. So,
No.
what are factors or things that they should look for that some of them actually just come in saying, I have bad skin, or I
Yeah.
don't have good skin. How do they know they need to come visit a dermatologist or that they may have eczema, rosacea?
Rosacea. Yeah, that's a great question. And this is again where I think it's so cool to be in a specialty like derm because we have overlap with different parts of the body and we
Yeah.
get to work with different healthcare providers like yourself. So rosacea, there's different types of rosacea. I think that's the first and most important thing to recognize. So in our minds, we think of four different types. One type is vascular or erythematotelangiectatic rosacea. And that's the rosacea where you have redness, typically redness of the cheeks, the nose, sometimes the chin and the forehead. And that redness is a persistent redness. And if you look closely, there often is what we call broken vessels on the cheeks or on the rim of the nose. So that's one type of rosacea.
Okay.
Another type of rosacea that we know of is papulopustular rosacea. And that's where it looks a little bit like acne, where you're starting to get those pimples and those pustules, again, typically on the nose and the cheeks.
Okay.
Um, Ocular is another form of rosacea that's well recognized. And the last is phimosis. And that's typically seen on the nose where we get that really firm thickening of the nasal tissues that leads to what we call a bulbous nose. That's less common. I'd say the more common types are the vascular changes and the papulopustular type, and they often coexist together. So different things to look out for is that persistent redness, sometimes also with flushing, and then pimples and those pustules on the nose and the cheeks.
Okay. So they're more isolated to those areas. So that's a big warning sign.
Yeah, that's typically where they present on the nose and cheeks. However, it can be on other parts of the face, but typically in these areas, correct.
And they can be treated, obviously, visiting your dermatologist and having whether it's cream or certain treatments to help with that.
Absolutely. And let's dive into it a little bit. So it depends first on the type of rosacea that you have. Papulopustular rosacea, first and foremost, is avoiding triggers. And for some people, triggers will be spicy food, alcohol, UV exposure. For some people, it's actually heat as well. And so avoiding those triggers is very, very important. And we describe rosacea as a chronic condition. So there's no cure for it, but we can manage it and manage how it flares. And so avoiding those triggers is very, very important. Um, Sun protection and all those things that we've already talked about play a big role in it. And the other component is using very, very gentle skincare. And often when we think about skin barrier, people relate that back to conditions like eczema, but that's very important in rosacea. The skin barrier in rosacea is often weakened, and so using skincare products that will support the health of that is very, very important. And then we have prescription creams that we can use to help with those papules and pustules on the cheeks. And we also have oral medications such as antibiotics, which are truthfully actually not used because it's not considered an infectious process, but it's used to decrease the inflammation that we're seeing. And we have some antibiotics that can help with that. And so that's the papulopustular component. Now, if patients have those vascular changes, typically it's going to be laser therapy that's going to help reduce the appearance of redness and those broken vessels on the face. And then, of course, all those other things such as UV protection as
Right.
well.
Right. I love how you mentioned diet. Diet plays a role in everything, and it's interesting how it's even playing a role in your skin, right? And
Absolutely.
dehydration too, right? Like not enough water, I think, plays a role in skincare. Is that true, or is that a myth?
I think, no, I love it. I think, okay, so true and not true, myth and not myth. So, myth in the sense that people who drink 2 to 3 liters of water a day can still have dry skin with their skin barrier, but
Okay.
not a myth because intake is so important for overall health, right?
Right.
And so, absolutely gut health, and we have more and more research. And I'm actually really excited for the research that will come out in the next 5 to 10 years, linking some of these skin conditions to the gut. But gut health, hydration, sleep, and stress levels play a role in our overall health. So, of course, those will impact skin health. And we
Right.
see it all the time when patients go through a stressful life period, whether that's something that they physically experienced, like a surgery or some sort of trauma, or whether it's an emotional stressor, whether that's like a change of job or going through something in their life, it can lead to hair fall, right? Like we know that it can exacerbate atopic dermatitis. And so all of these things are linked. And I know we don't have the ability to say like A plus B equals C, but we know they are linked somehow in some way.
Right. You mentioned laser therapy. I know this is not related, but when you
All
said
good.
that, what I pictured is you're scrolling on TikTok or Instagram and you see all these women with these, I want to say they're white masks with red light therapy inside.
Ah,
Okay,
yes.
tell me what that's all about and what it's doing. Like, is it helping with
Okay.
these conditions or is it helping like hydrate your skin? Why are these women wearing these masks?
I love it. The scary
I'm
masks.
putting it in layman's terms. Listen, we don't
No,
we
I
don't know
love
what
it.
this is.
Oh, I love it. So those are LED light masks, and
Okay.
I feel like they've picked up recently, especially on social media. And it's a mask that's used daily, depending on the mask, 10 to 15 minutes. And it's meant to help with skin quality. So helping with the way the skin appears, helping with fine lines. And, there's some claims out there that might help with different skin conditions. I think the research is definitely evolving on some of these particular claims, but it's been used for a while. It used to be available as an option to add on to a facial treatment at many of these places. And now this is a device that's available at home. I think it's something that could be used as a supplement to a really good skincare routine, and remembering that consistency is the most important part of it. But it doesn't matter if you're not doing that SPF protection. And so, right.
Good old
And
SPF.
so, yeah, yeah. And so,
So
yeah,
it's
we're
not
seeing more.
something I need to incorporate into my daily routine. Is this mask something that I should be doing or anyone should be doing, or it's more like it should be recommended from someone to do this?
I think if patients want to try something new and have the finances and the time means to do it, it's not unreasonable to add it
Okay.
on. But I don't think everyone needs to do it. Um, I think again, like having that basic skincare routine will be the most important step before we even look at adding any of these sorts of things.
So, I know you mentioned ocular rosacea as well, and obviously in the eye field, that's a big thing for me.
Yeah.
So, tell me, and maybe we can learn from you and your tips as a dermatologist. So, tell me some tips that we can recommend to our patients for dealing with ocular rosacea.
That's a great question. And I even think maybe we could highlight some of the symptoms that patients experience, because they're actually really non-specific, right? It's like the dryness, the burning, stinging, light sensitivity, and that foreign body sensation. And so if you're experiencing those symptoms, it's actually really good to get checked out, because those aren't specific to rosacea, but could be a sign of
Right.
rosacea. And so for us, we often recommend general good measures for ocular health. And so that's using warm compresses, making sure that the eyes are hydrated with artificial tears. And then we look at using some of the medications, especially the oral ones, to help with the ocular symptoms. And that's often done in conjunction with eye specialists to make sure that they're getting the proper examination and that have that follow up around those symptoms.
Absolutely. Another thing that, I'd like to add to that is, maintaining that lid hygiene with, prescribed lid wipes with your optometrist, or even considering treatments now, right? We have like radio frequency now, we have IPL now to help. And
Yeah,
a lot of patients don't know that we have these treatments available in office to easily help with their rosacea symptoms and signs as well. So I love that. And I love this sort of professional collaboration where we can collaborate with their dermatologist to let them know, what they're using and what they're not using. And sometimes they are on these oral medications, whether it's doxycycline or
right.
whatnot, in conjunction with being treated. So that's huge. That's huge. Thank you.
Yeah, absolutely.
So I have to ask you this.
Okay.
Tweens or tweens, right? Um, the Sephora trend, right? I mean,
Yeah.
like you said less is more, right? And
Absolutely.
I'm going to just talk about my niece here because she's 10 and she has 100 products and I have like four. And she's one of those, tweens really into Sephora. So, you know, what is it so appealing about all these products to these tweens now? Like, I would never spend my money on this stuff, but they are obsessed with their skincare. Why? What? How? And why?
I feel like social media is such a big part of this. I had a patient earlier this week who had requested her birthday gift to be Sephora gift cards and went into the store and made her skincare purchases. And again, like I think like I was saying earlier, like for all of us at some point, I remember being obsessed with skincare. I still am, of course, but I remember that kind of starting it when I was a child and looking at my grandma and my mother use these different things. But I definitely think social media is fueling the desire for a lot of this. And I think it's really important to recognize that it's our job as healthcare providers to educate on what patients really need. And really, the less is more. The number of patients that are coming in with reactions to different skincare, to
Mhm.
acne from using skincare, has been increasing. I'm seeing more and more of that on a regular basis. Both in medical and cosmetic dermatology. And so I think it's really important to recognize that it is leading to skin changes that we don't want to induce in young teen skin. Like tweens have amazing skin. Their skin regularly turns over. And the things we need to do is to protect that and hydrate. And ultimately, I think the only things tweens need in their skincare is a gentle cleanser, a good moisturizer, and a good sunscreen. And of course, if there's concerns about eczema around the eyelids or if there's acne on the cheeks, that will change. But in general, for a patient with that's in their tweens, doesn't have any underlying skin
Right.
conditions, we just need those three things. And I think we can have fun with those three things too. It doesn't have to be boring. I think there's a lot of great drugstore brands available. There are brands available in Sephora. But it just needs to be targeted for the right person, and tweens don't need to be using AHAs and
Like
BHAs and
serums and all of
retinols.
it.
So yeah, exactly. They don't need vitamin C. They don't need all these face masks. It's less is more. Less is more for sure.
I'm sure every single parent on the planet is going to be making sure their tweens are listening to this on their way to school. Um, so,
Love it.
obviously, I'm going to ask you, how do you like what is you're a busy professional, right? I mean, you have
Yeah.
practices, you're working, you're at conferences. It's not easy to do skincare. I'm not going to lie. Like for me, it's very fast. I don't do much. What do you do?
Absolutely. Okay, let me walk you through it. This is my favorite question. So, in the morning, I use a hydrating cleanser in the morning, and I follow that with a vitamin C serum. And then that I follow with a tinted SPF, and then I proceed with my makeup routine. I'm similar to you. I don't have a multi-step routine. In the evening, I do a double cleanse. So I use a makeup removing balm to take everything off,
Okay.
to get rid of the sunscreen and the makeup. And then I follow that with a hydrating cleanser. And I find that double cleanse is important for me to be able to get everything off from that day. And then I follow with moisturizer, and then I follow with retinoid and then moisturizer. So I sandwich my retinoid between two layers of moisturizer.
Wow.
Yeah, I find it, I'm able to tolerate it better. And then a couple times a week, I'll use glycolic acid instead of a retinoid to help exfoliate my skin. And so it's simple. I have a simple skincare routine. That being said, I am an absolute product girl. And of course,
Ah,
as part of my job, I end up testing a lot of different
yeah, yeah,
products out.
right,
So
right.
I'm often swapping things in and out, but really it's consistency to see any changes with skincare.
I love that. I love that. I don't know if I'll ever do as much as you do. I think it's still
What's
too
your skincare
complicated for me.
routine?
Yeah, what's mine, eh? Nothing. I wash my face and I put on my face cream, but I do wear SPF every single morning. And it's funny because I was always teased in university because my parents had ingrained it in me to always wear SPF, is I would have sunscreen on rain or shine. And that myth, which should be another myth about you don't need sunscreen in the winter time. And everybody would make fun of me because I would wear it in the winter because there's still UV radiation, right? And
Absolutely.
people left.
The weather does not correlate to the UV index. That's a great myth. And so in the winter, we still get sun exposure. And often in places where there's a lot of snow, the snow reflects UV back.
Right.
And so it
Right.
might even be increased UV exposure
Yeah.
compared to other seasons. And so it's really important to have that daily SPF protection. Absolutely.
So mine is simple, but I got the most important
You
component
got the
down,
most
right?
important. Absolutely, absolutely.
Thank
And that's the other
you.
thing, like,
Yeah.
people don't have to dive into every single step right away. I think it's
Right.
building it over time. And if you're going to introduce one thing, it should be the sunscreen, and then the other components you can add into as you get more confident and comfortable with your skincare routine.
Absolutely. Thank you so much, Dr. Ledda. Like that was such great information for our listeners, our viewers. I know it was a lot to soak in, so they might need some time to soak it all in. Tell us, where our listeners, viewers can find you, social media, or your practices. If they do want to reach out and consider, an appointment, tell us where they can find you.
Absolutely. So social media is at Dr. Malika Ladha. Um, and I practice in Thornhill at Thornhill Dermatology Center.
Excellent. Thank you so much for your time today.
Oh, my absolute pleasure. I had a lot of fun. Thanks for having me.
Thank you. Thank you, listeners and viewers, for tuning in. If you want to catch more episodes of Uncover Your Eyes, make sure to follow or subscribe on your favorite podcast platform and on YouTube. To learn more about me, follow me on Instagram at dr.Meenal Agarwal. Until next time, keep those eyes uncovered.